couple of things. You'll notice that you have the therapist across the top. It'll say the date and actual calendar day. So it'll say the calendar day and then the day of the week. You'll notice that the hours are located here. If you actually click on the schedule, a couple of things will happen. The therapist's name that you selected, that person's name will turn red, as well as the time that you have selected, so that turns red as well. And just to orient ourselves a little bit more to this area, you'll notice that we have some white fields. So the white fields indicate time that the therapist is available to treat, and then the gray fields above and below the white fields are actually times that the therapist is unavailable. Similarly, over here on the calendar, the date that we have selected is indicated by this blue color, this bright blue color. So if I were to go back a day to the 7th, you'll notice a couple of things, that the day that I selected, so Monday, December 7th, has turned blue, but today's date is actually orange, so it kind of gives you a good way to track where on the calendar you're at, and we can just pop back over to today. The current month that we have selected is indicated by this white color, and then the previous month and coming month are indicated by this light gray color right here. Weekends are shown in light blue. I'm going to come back to talking about the hide fill appointments button, the view appointments by client, and then this by staff and by available appointments tab. These will be really useful to you as you're scheduling patients. But first and foremost, let's practice adding a new patient. So we have a couple of ways to get to what's called the client editor. You can either push the edit button and then client. If you prefer to utilize your keyboard, you can push F9 and it'll take you to that same spot. Alternatively, we have some hotkeys right here along the right-hand side, and this is just a quick way to get to the client editor by clicking on these guys right here with the blue and green shirts. So we're going to click on them. And you'll notice that it's now opened up the client editor. If we are working with a patient that currently already exists and is active, you would simply just drop down right here, and it would show you the current active patient.
Who is?
Hey guys, if you could stick yourselves on mute, that would be really appreciated.
What did she say? Anicia, can you repeat that?
Oh, could you put yourselves on mute, please?
Oh, on mute? I don't know how to do that. Okay. What did you say, Anicia? Sorry.
Do you mind muting yourself?
Oh, no problem.
Thank you. If we want to find a patient that we know has come into our clinic before, but isn't currently active, so maybe this is someone that was discharged 6 months ago, we would either click the Show All button and start typing their name, and then drop down to that person. Alternatively, you could also search for them, so you could utilize the clinician ID number. And this is something that gets added to the patient. Once we create a patient, every patient gets a clinician ID number. Alternatively, you can search by first name, last name, or date of birth. And then pushing the search button will pull all those folks up. So let's say we actually want to go ahead and I'm going to go back to the start. So let's say we want to add a new client. Right off the bat, you might want to start clicking around and typing the person in, but you'll notice that none of the fields are active. So our first step is to actually push this new client button, and then it's going to ask us for a couple of fields that are required for us to create someone in the system. So the way that we do that is we enter the date of birth, last name, first name, and then gender. Those are our 4 required fields, and they're indicated to us with a little star. So I'm going to go ahead and enter in a birth date. And you'll notice something. So I entered in a birth date that the system recognizes already, and it is showing me that we have someone with a matching birthday. If this is the patient that we wanted to use, we could click on that person and say, use selected client. If it's a different patient that we're entering in, we can go ahead and put them in the system. You will notice that the fields, by clicking OK, have become active. You can enter in additional information if you're able to get that over the phone. We encourage people to collect the Social Security number just because it's a great way for if you ever have to send a patient to collections. That's kind of a great way for collections to track those folks. But we can go ahead and enter in additional information. And their address. If you enter in a zip code, you'll notice that it actually populates with the city and state for you. Now, one neat feature of the system is that you can have patients opt into what we call automated appointment reminders. So from this drop-down menu, folks have the option of selecting either email or text message appointment reminder. If you select text message, you do have to indicate who the carrier of the cell phone company is. If a patient has kind of an off-brand cell phone company, just go ahead and Google them and you'll be able to find which towers they use. And so then we would select that and go ahead and enter in their phone number. And maybe they also provide us with their home phone. All right. This additional field right here allows us to capture whether or not the patient has a nickname. So maybe in this case, this patient's name is actually Douglas, but this patient prefers to go by Doug. This is actually what we call a patient note. So this will show up every time you select or click on a patient's appointment on the schedule, and I'll actually show you what that looks like. There are a few more appointment note areas on this page, so you'll see that there's notes right here. These notes are useful for if you have conversations with maybe the insurance company, maybe it's you want to capture why a patient showed up late or that they called in and canceled or rescheduled. This is an appropriate area to capture that type of information. And then at the bottom, we also have an area for employment information and emergency contact information. As we add what we call our cases, and we'll go over those in just a minute, but they would show up here, as well as any appointments that the patient might have in the system. I'm going to pause right here and allow for questions. So if you are on mute, go ahead and unmute yourself. And for the folks that I'm muted, I'm going to go ahead and unmute you right now. Are there any questions about this page? All right.
Hi, sorry, I have a quick question.
Oh, sure, go ahead.
So, you said that it was just a message or an email reminder or text message, but what about, do they do house calls too? Because I didn't see if that said none.
Do you mind speaking up? It's a little bit hard to hear you.
So for the reminders, how you can put a message or an email, did the other option say none or like can you do a
Pardon?
Can they do a phone call for the reminders?
No, there is no phone call option, which is something that'll be a little bit different from how you currently have your system set up. There's only text message and email.
Okay, that was my question. Thank you.
My pleasure. Are there any other questions?
Are they able to do both of them, like an email and a text?
No, the system only allows you to select one from the reminder drop-down, so those are, you kind of have to pick one or the other.
Okay, thank you.
Any other questions?
Also, in the additional information, would the patient ever see that?
No. However, this notes field right here, this other one that we were just talking about,
Yes.
where we kind of entered in information of whether or not you talked to their insurance company, this would be able to get printed out and submitted in a court of law should the organization ever face a lawsuit. So it's important to be very careful about what you enter into this field. This field does not print out.
Okay.
That's a great question. Any other questions? All right, let's continue on. So the next tab over is what we call the case information tab. And this really captures why is the patient coming in to see us. Some folks like to have something very specific. Some folks put ICD-9 or 10 codes here. It's kind of up to your leadership to decide how they would like this information captured. And similarly, you'll notice that I'm clicking around and none of these fields are active yet. So again, I need to push this new case button. If the situation is like, say Doug calls us and he's like, just give us some preliminary information like his last name, first name, date of birth, and gender, and then maybe some insurance information, but forgets to tell us why he's coming in. We could capture that by saying, please collect at time of service. And then you would actually go ahead and rename this. This is the most crucial piece. You cannot place someone on the schedule without a case. This actually causes a lot of issues, and then the therapist isn't able to document on it. So we always want to make sure that we add a case with some kind of information saying to either remind ourselves to collect it or that patient hasn't indicated yet. For this example, let's give Doug some knee pain. And I just clicked OK. You'll notice that these fields have now become active, so I can click around. And I'm going to go ahead and talk about the fields that are associated with the patient care coordinator position. And then I'm going to show you the other two fields that will be the responsibility of the therapist as well. So the first box that we see is called onset date. This is the date that the patient first experienced the symptoms that they're coming in to see us for. So we're going to ask Doug, when did you start experiencing your knee pain? And he's going to say maybe it was a week ago. So we'll have entered in a week ago. And that captures when he first started experiencing this knee pain. The next two dates, the signature date and admit date, tend to be the same. The signature date is the first date or the date that the patient has signed off on the paperwork to be seen at our clinic. So we'll select today. Now the admit date is the first date that the patient will be seen at our clinic. So this will also be today. Generally, these two are the same because folks are coming in on the same date that they're filling out their initial intake paperwork. Now the next two boxes below right here are called authorized to receive payment. So what this is letting us know is that the patient has authorized us to receive payment on their behalf from their insurance company. This is what they're signing off to when they fill out the intake paperwork. So we're going to check mark this one. The never sent statement to patient prevents the system from sending out anything that might be at patient responsibility. So very rarely do we want to actually select this item. So that being said, we almost always will have this one selected unless there's payments maybe being routed through a third party. The situation here might vary, whereas here maybe the statements or outstanding balances might get sent to a lawyer, a case manager, those types of folks. So this would be something that your leadership kind of can indicate on when they would want you to mark this box right here. Now, if the patient is coming into our clinic to be seen for an incident that happened, we can indicate what type of accident they experienced. So we have the option of auto, other, or tort, meaning a lawsuit. Alternatively, we can also select this as a work-related accident. If it was a work-related accident, we can drop down from here and select the employer. If the employer does not currently exist in our system, we can push the little ellipses button and then go ahead and enter in the employer's information here. The facility is the treatment center for the patient, so the clinic that they're coming to be seen at. The supervisors, the primary therapists that will be overseeing their case. The discipline will actually default based off of the therapist. So if this therapist were actually a OT or a speech therapist, that's what would be indicated in this discipline box. Program type, this is if the patient's coming in for maybe a running clinic or maybe a golf clinic. So your leadership can actually change what appears here, and they might, based on the types of programs that they put on within your organization, these might be different. Now we have the option to identify a primary physician, which could be different than the referring physician, so we can actually capture this information in two spots. Maybe this patient's primary physician is this guy, and then right here we have what's called the referral source and referral information. So this box allows us to capture how the patient heard about our clinic. So we can say maybe they're a gym member and we ran an ad at that gym location. Maybe they heard about our organization through the Yellow Pages or a Yelp review. Maybe someone internally referred them, or possibly it was another patient. So we can go ahead and say that they heard about us through a Yelp review and they asked their doctor to come to our clinic, and the doctor that actually referred them is this doctor right here, Dr. Nemo. One thing you'll notice is that both of the doctor's names that I have entered in as the primary MD and the referring MD have showed up in the send reports too. This just means that should the therapist or you decide to send some information about this patient out, this is who the reports will get sent to. You can add more folks if that's appropriate, like if you know there's a case manager on the patient's account, or maybe there's a third party that needs to get involved, you can also add these to the send reports to list. Now, because this patient came over to us with a script from the doctor, if there actually was something indicated on the script beyond just physical therapy, we can add information that the doctor said the patient should come in for 12 visits, and we can enter in the date that was effective. If nothing came over on the script from the doctor, you could just capture who referred the patient and leave this field blank. One thing that's always just something really good to check is to make sure that the case status right here says active and that we capture the active on date, making sure that it's before we go ahead and schedule this patient. Now these two boxes right here are the responsibility of the therapist unless otherwise indicated by your leadership. So generally, the therapist will be able to enter in the ICD-10 codes as well as telling the system that they initiated a plan of care. So I'm going to come back and talk about these two fields because they are important for you to know how reporting is done. But we'll come back to these. The next box below, we'll notice, is payer information. Again, similarly with the previous field, I'm clicking around and nothing's happening. So we can click this Add button, and now this allows us to edit these fields. So we can enter in the insurance, the patient relationship to subscriber, so how is a patient related to the person who is insured. There is a very large list here. You can select from the drop-down list. If it's the actual patient, please just select self, and it will default with their information right here. If it's someone other than self, you'll get prompted to add information about that person as well. Then it'll ask us if the benefits are verified. You will have something that's called e-verification. So what this will do is it will, in the background, contact the payer and ask the payer if they are aware that this patient exists and if the patient is tied to that payer. You will, however, still need to call the payer to gather information on copays, coinsurance, and deductibles. But the e-verification will, at a minimum, allow you to at least confirm that the payer is associated with this patient. Then we'll actually pick up the phone and call the payer and gather this type of information, enter in a copay, and perhaps this patient also had a deductible. If the deductible has been met, you can select this. If it has not been met, our system does allow to collect on deductibles and coinsurance, and we'll actually talk about how to go about doing that. These two fields right here, max billable amount and max visits allowed, these two fields are purely informational. So these two fields will actually not track. This field below, insurance authorizations. So if the payer requires an authorization, we would just go ahead and click the Add button, enter in the number of visits that they authorized. If it was units, we could indicate that as well. Perhaps the insurance has only authorized 20 visits within 90 days, so we would go out 90 days and drop that in here. And maybe if there was an authorized amount or an authorization number. You'll notice that in a couple of these fields that we've gone over, there's little paper clips, and this allows us to attach information here. I will come back to both of these to kind of talk further about how to attach scan in papers or attach files. You'll also notice that there's another notes field right here. This is actually a great space to capture correspondence between either your organization and the patient, the therapist and the patient, or the referring physician and the therapist. So this is a great area to capture correspondence information. I'm going to pause right here and allow for questions.
I have a question.
Sure.
So the billing, if we're billing an attorney and not collecting from the patient, we don't click the Authorized to Receive Payment button?
If you're billing the attorney.
So if there's a patient coming in for a liability, a lot of times they'll say, you know, if the patient doesn't have health insurance or they've maxed out MedPay and they don't have health insurance, then we'll bill the attorney directly.
Mhm.
So would we not click the authorized to receive payment button?
No, you would still click it because the patient is authorizing your organization to receive payments on their behalf.
So would that still come up? Or, for instance, if the patient has health insurance and the attorney will say you can bill me for their deductible and copay,
Okay.
and then we click the authorized to receive payment button, then every time they come in, it's going to pop up the collect copay box?
Yes.
Is there a way to avoid that happening?
There's not a way to avoid that happening. You would just have to know that that's going to get, that those bills or that balance will get reconciled via their lawyer.
Okay. And then the other question I had was if it is a liability, we're clicking tort. Is that correct?
Yes.
Do you know what that stands for?
It's just another name for kind of a court case.
Okay. All right. That was it. Thank you.
Are there any other questions?
I have one, and it's kind of what Kelsey was asking. Like,
Okay.
would we still enter in the primary payer, the private health insurance information if we were only going to bill the attorney?
If you were only going to bill the attorney and everything was going through the attorney, you would actually go over to the guarantor tab and enter in the guarantor. So the guarantor in this situation would actually be the patient's insurance.
And not,
Sorry, the patient's lawyer.
so we put that as guarantor. Okay, so then would we not enter in the primary payer information, or would we
If
still do
there's
that?
anything that the lawyer is not going to cover, I would still enter that in here. But just know that it's going to pull from the guarantor tab.
Okay, that I get, but what if, and maybe I'm just not understanding it, but what if we're not billing the private health insurance at all?
Then I wouldn't
And-
enter that information in.
Do we enter it because we keep both as a backup? So would we still enter it there?
I mean, you could. It's kind of up to your leadership on, do they want you to enter it all in here, or do they maybe want you to have it capture that information elsewhere? If it's only going out under the guarantor, then select, you can still enter that information here under the primary payer, but select the guarantor tab as the active tab.
Okay. All right, that makes sense. Thank you.
How do you select the active tab?
So by clicking it, I've activated this tab over this one.
Oh, so it's just whatever's showing.
Correct.
Okay. And how about inactive? So if we put like say if they have Blue Cross for health insurance and we want to put it in there and we just don't want it to be active, can we do that?
Yes.
So then we would
So
never.
if you want to capture that information, but you don't want it to go out under that,
Correct.
then you can capture it here, but you need to indicate that this is the active tab by selecting it.
Okay.
It's kind of up to your leadership to kind of decide how that will be managed, just because, and this is kind of me putting my 2 cents out, as far as entering it in, I could see folks forgetting to click away from the primary care. So I would almost capture that information in this notes section or this one right here, because then this one at a minimum has a running tab on who entered it and when.
Okay. Thank you.
My pleasure. All right. I'm going to continue on to the letters tab. So there, and I think this is one of my favorite features of our system, is that there's preset letters in the system that kind of allow for information to be quickly dropped in Your leadership team is already working on updating these and kind of making them your own. I'm going to show you just kind of an example of one that we have in the system. This is probably not what yours will look like, but just to give you an idea. So my clinic information has pre-populated here. It allows me to have a logo here. Patient information that I've already entered into the system is showing up here. And this just makes it really easy for the patient so that when they come in, they can review the information and update it if needed. And then at the very bottom right here, there's some information capturing financial responsibility as well as a notice of privacy practice. So then they would just sign off and hand it back. So let's say I selected this one for the patient. Now you'll notice that I have a history column here. So this is capturing all the letters that I've applied to the patient's account as it would be, meaning if someone wanted to look and see what information this patient has received, that would be available there. And then we can review the letters here. Sometimes therapists might choose to apply a letter to a patient's account, and so maybe it's a discharge letter and they don't remember if they discharged one, you'd be able to click on the actual line item and view the contents of that letter. Let's say on accident you applied a letter to a patient's account that you didn't actually print out and hand the patient. So maybe you were practicing and you were going through and you accidentally clicked on the patient survey cover letter, and this isn't something that you've already sent out to them. You clicked OK, and now that's there, so it looks like that was applied to their account. And we actually want to go ahead and talk about how to remove this. So we're going to double click on that item, and it's opened that letter back up for us. From here we have the option to delete, and it's going to give us a little warning sound and notify us we're actually about to delete a letter. The way that it sounds is that you're deleting the template, so the kind of default format, but you're not, so just know that you're okay if you click yes. So we're going to click yes, and it just removes it from the patient's history right here. The next tab over is called Attachments, and off the bat you would think that you would be able to click somewhere here and it would start attaching things. That is not the case. We actually want to go up here to where it says Attach, and then from here we can actually tell the system what it is we're attaching. So if we're attaching authorizations, maybe it's a driver's license, insurance card, medical report, plan of care approval, or referral script. Now my favorite is this case record, and the reason I like it is that you can add your own description to it, and it's kind of a catch-all. So it captures any type of information that has to do with the patient's case. So maybe this is a letter from the physician. Maybe they brought us a medication list. And then from here, we'd be able to either scan or click the Attach button. Now I'm going to close this because the system actually has a couple of links for us to just quickly attach something without having to go all the way to this Attachments tab. So I'm going to show you where those are. I'm going to push close. And we're going to go back to the Personal Information tab. Some of you may have noticed that there is a Add ID card button right here. So we would just push that. And then from there, the system knows that we're scanning in a driver's license or picture ID. So we can scan or attach that here. Similarly, on the Case Information tab, we have one for an insurance card, so we just would push the Add Card. It would pull up the insurance information that we'd entered in, and we'd be able to scan or attach it. We also have paper clips throughout the system that allow us to just very quickly attach that item. So if we're attaching an insurance authorization, we would enter that in. It would also have the information that we entered in captured here as well. And then scan or attach. You can tell that something's been added because the colors of these icons actually change. So the paper clips will become blue and this will look a little bit more yellow. So from attachments, we're going to go over to precautions. Precautions are really useful when you need to communicate something to the therapist about the patient that you don't want the therapist to forget. And the reason why I really encourage folks to use precautions is because when the therapist goes to document on the patient, it'll actually show up from their end as a giant red banner. So I'm going to have you push add, and then we actually have some preset items in here. Oftentimes the patient might indicate something to you all as patient care coordinators like, oh my gosh, I woke up so dizzy this morning and I'm just having kind of a lot of nausea. So in the notes section, you can tell the therapist that. Woke up dizzy. That way the therapist knows that maybe it would be a good idea to not put this person on the treadmill to warm up. So you could also add that. All right. So that's precautions. There is also one that's kind of a catch-all here, and I believe it's titled Other. So if there's something else that the patient is indicating that isn't captured by these options here, you can utilize the Other and just know that the notes will show up. Alternatively, you can talk to your leadership and they can add new precautions into the system. The next tab over from precautions is called Additional Claim Information. This is where you would be able to see patient claim information. Because this patient hasn't come in yet, we do not have anything captured here. Last but certainly not least is called the change log. So this allows us to see who entered in information on this patient and when that information was entered. So you'll notice that the old value is here. The new value is here, so this is the information that we entered in, and they were all blank before. It shows who entered them in and when. Similarly for case status, and once we've actually entered in appointments for this patient, it would also display appointment history. So I'm going to close out of here, and then we'll talk about how to actually schedule the patient. But before we do that, I do want to leave some time for questions. Does anyone have any questions about what we just talked about? All right. So now we've entered in the patient. Just so you all know, we went through the entire client editor, but the only information that you actually need to enter in prior to putting the patient on the schedule is the following: first name, last name, gender, date of birth, and a case. So just the case description, not necessarily all of the insurance information. Your leadership might indicate to you that they might want more information captured prior to scheduling someone, but if you have a lot of folks running up and it gets hectic, just know that you can enter that preliminary information, but then you'll have to follow up with completing it all at once. So we're going to select a time that the patient has indicated that they want to come in, and I just right-clicked on this time. So Doug came in and he's like, I want to be able to be seen today. Can you get me in at noon? So I right-clicked here, and you'll notice that there's a couple options for me here. I have new appointment, add other appointment, estimated patient responsibility, and add attachment. So I'm going to select new appointment. From here, the system actually defaults to standard visit. We encourage that the default stays at standard visit just because this is probably the type of appointment that most folks will be coming in for. But in this case, we're going to change it to initial eval. The system does pull up the last patient that I was working on, so it just pulled up Doug. I see that I've entered in a case, or someone else entered in a case, the start time, end time, and an appointment note. So maybe an appointment note is tied specifically to the appointment that the patient is coming in for. So maybe in this case, we want to scan in ID and insurance cards. It'll show us the treating clinic, so the clinic that the patient is going to be scheduled at. The status of the appointment should say scheduled. And from here, we have a couple of options. Perhaps this patient is someone who might get rowdy, or the therapist might need additional support providing care to this patient. You have the option of adding another staff member to help support that therapist. So we can go ahead and add additional staff. Then this next box below is called resources. Your organization may choose to add or not add resources in the system. I'm just going to show you what this looks like. So in my database, I just have exam rooms. Generally, resources are items that only one patient can use at a time. So one thing I've seen before on the resources list is anti-gravity treadmill, or maybe it's a single-person swimming pool. So you can kind of capture that those pieces of equipment or rooms are in use by a patient. So I'm going to click OK. Oh, apparently Harry Potter is not working at noon, so we need to find someone else. And now we've scheduled that appointment. You'll notice that there's a couple of icons on my actual appointment. The first one that I see here is a little envelope, and this is just letting me know that the patient has opted in for automated appointment reminders. As your schedule books out and you want to see if an automated appointment reminder actually was successful and went through, this will be indicated by a little check mark on the envelope itself. The little exclamation point is letting me know that there's some kind of appointment note tied to this appointment, so I'm going to actually click on it, and then it provides us with some additional information. So I see here that there's a specific appointment note, so it's letting me know that I need to scan the ID card and the insurance cards when the patient comes in. I also see here that the patient has let us know that they actually prefer to go by Doug. I see that they have a home phone, a cell phone. I can see why they're coming in to see us, who their referring physician is, and what type of insurance they have. I also see that they have a resource tied to their appointment, so they're going to get placed in exam room 1. And I see here that our therapist, Peter, is going to be helping out with this patient. In the situation where the patient wants to come in following their visit, let's say they want to come in Wednesday, Thursday, and Friday, I'm going to show you how to schedule recurring appointments, and then we'll talk about how to change the status of the appointment. So in order to kind of view a therapist schedule and schedule random days, what I'm going to have you do is select the staff member from the drop-down list, and then hold the control key down as you're selecting the days that the patient has indicated they would like to come in. And as you'll notice, it's actually pulling those visits up for us. From here, I can tell it that I want a new appointment. It's going to default to the patient that I just touched. So it was someone else. We're going to go back to Mr. Schumann. And I'm going to go to the bottom and click recurring. So perhaps he would like to come in every Monday, Wednesday, and Friday, and he's going to try this out for 3 weeks. So we're going to click OK. And it has scheduled the recurring appointments for us on those days. Now let's go back to today and practice arriving and failing the appointment. So I'm going to right click, and now you'll notice that there's more options for me. I have the option to indicate that a reminder has been made. So maybe I noticed that the automated appointment reminder didn't go through, and I want to indicate that a reminder was made, I would click that. I can view client appointments, which shows me all of the appointments that the patient has in the system. I can view the cash register, estimated patient responsibility, I'll come back to in just a moment. And we can also print the patient schedule. Last but certainly not least is the status. So we would hover over the word status. And then from here we would be able to indicate what's going on with the appointment. So if the patient arrived, we would click arrive. The cash register is going to pop up. We can enter in an amount. So maybe this patient's going to pay in advance. If you select credit card, it'll ask you what type and the card number. It's also going to capture that they've overpaid, so the next time they come in, it'll actually withdraw from the balance on their account, and we're going to click OK. If we would like to print a receipt, we can actually go ahead and indicate that we would like that, and this is what the receipts look like. Okay. If the patient had not paid, that little green dollar icon would actually stick with their appointments on the schedule until they reconcile the balances on their account. You'll notice that my arrived appointment has changed color. Let's say the patient actually has an emergency and they can't come in and they decide to reschedule. Because we want to refill this time with another patient, what I can actually do is click Hide Failed Appointments, and this hides any appointments where the patient has failed to arrive to the appointment, and then we can go ahead and schedule someone else in that space. This is what it would then look like. So we're not deleting appointments off our schedules, we're just hiding them if they've been marked as failed. Failed means canceled with notice, canceled without notice, no-show, or rescheduled. Perhaps he actually called us and said that he could come back in. And we're saying okay. Are there any questions about this?
I have a quick question.
Sure.
Okay, so on the appointment type, do you know if it's been decided? I know that you said just to leave it as, I can't remember the wording you used, I'm sorry. But do you know if there's going to be options for different types of insurance like Medicare, neighborhood, workers' comp, anything like that?
That is up to your leadership. We actually generally encourage our clients not to do that just because that information is shown here by just clicking on the patient.
Okay. And then the other question I had was when you're scheduling a couple days in advance and you're clicking around the schedule, is there a way to view more than one PT's schedule at a time on those specific days? Because the drop-down, you could only select one. Is there a way to select more than one?
The only way there's the option to select more than one is if there were teams
of
therapists.
Okay. Okay, that was it.
All right. So I'm actually going to take the time to now show you some of the really neat reporting features of our system that will help you better manage your patients, their appointments, and money tied to their appointments. So the first list of reports that I'm going to show you are right here on our task tab. There are two that are here for us. The first one is the corrections queue, and then the next one is appointments at risk. Appointments at risk are essentially any appointments that are scheduled in the future that maybe have something that we still need to enter into the system or have incorrect information or missing demographic information. So this is our, I like to refer to it as our proactive list. So this is letting us know about upcoming issues that we might have if we don't fix them before the patient arrives. Our corrections queue up here, on the other hand, is actually for appointments that have not only been arrived, but the therapist has finished signing off on the documentation. So we can look at the items by either the age, so how long they've actually been sitting here, or by the dollar amount that they're holding up. Your leadership will work to indicate who is responsible for completing these items. This is really great because this is actually something that holds up claims. So, you know, working these daily will allow you to help support your billing team and make sure that items are getting out the door faster. A lot of what you'll see here is demographic information, maybe something specific is missing about the patient or their referring physician. So this is the type of information that will be captured here. Now we have two other reports. These reports are actually found under the word Run. So that's between the Reports tab and the Charting tab. So they're under Run. We're going to click on the word Clinical Issue Listings. And then from here we have a couple of options. We can filter by the actual clinic we're working in or by a specific staff member. The type of information that we'll find here is whether or not insurance authorizations are about to expire, whether or not the patient has not been active, meaning they haven't come in to see us for a while, so maybe it's appropriate to discharge these folks. That would kind of prompt a conversation with your therapist on, hey, should I be discharging these? What type of follow-up would you like me to have with these patients? No First Appointment captures information on patients who maybe were sent over to us with a referral, but they have not actually scheduled in a first appointment. So this would be a great way to kind of monitor who you need to follow up with. Plan of care approvals. So I'm sure all of you are very familiar with this, where the therapist sends out a plan of care and then you are calling and tracking and trying to get a hold of the doctor to send back a signed plan of care. This is where it lets you know which patients you're still waiting on a plan of care for. So instead of kind of tracking it via the papers and the patient's charts, the system will actually let you track it here. And I'm going to show you what entering the information in looks like. So I know when we were first going through the case information tab, I indicated that this plan of care box is for the therapist to enter in. And what the therapist did was they pushed this Add POC button. From here, when a signed plan of care comes back to you from the doctor's office, what you will do is enter in the date that it was signed by the doctor. And then you will be able to scan it in. I'm going to save this and close it, and you'll notice that that patient has fallen off my list. Plan of care due. This is just letting you know which patients have an upcoming plan of care, and it allows you to have a conversation with the therapist and then appropriately schedule the patient. So maybe this patient actually needs to get discharged, or maybe it's a progress evaluation that needs to get scheduled. Referral expirations just notifies you that the script from the doctor per the doctor is about to expire, so maybe you just want to reach out to the doctor and let them know, or whatever follow-up is appropriate in that regard. And last but certainly not least, this also gives you kind of the ability to see whether or not therapists are over or underbilling. If you see at any point that a therapist has overbilled, just let them know to kind of view that in the chart. Again, this is something that your leadership will kind of hash out on who's running these and who's monitoring these reports. So I'm going to close this, and I'm going to show you the other report. Again, it's under the Run tab and the Claims Issue Listing. Now, this is something that your billing team might ask for your support on. There's information that you might be able to gather to help them out with. It's just good that you're aware that this report exists, and so if you get asked to find certain information, know that this is where it might be coming from. I'm going to pause right there. And before I allow time for questions on that, I do want to just kind of show you the resources that are available to you. So when you come to the support site, you're going to log in as though you were logging into the actual database, same username, same password. And then instead of clicking on front desk right here, I'm going to actually have you click on training and front desk. Oh, it's going to have me log in. And from here, you'll notice that there's videos you can watch with practice exercises tied to them, going over the same information that we talked about today. So registering a patient, scheduling them, patient payments, tasks, which we did not touch on, but the issues list that we just talked about. And there's also this right here, front office frequently asked questions. I strongly encourage you to bookmark this page. I want to say something like 95 to 98% of my clients at some point ask me a question available on this list. So it's just a really great resource in that regard. The other resources that I strongly encourage that you take the time to look over are found here under user guides, under patient registration, patient scheduling, and patient payments. So as you're practicing and learning the system, if you have a question about something in regards to patient scheduling, I'd encourage you to kind of get familiar with the user guides. All of the information about the system is available under the user guides. So as you're going through and you find an article that you find interesting, maybe it's scheduling appointment resources, you would click read more. Some articles have a video tied to them and others are just the article itself, but it walks you through how to kind of complete that objective. And last but certainly not least are the Q&A webinars. This is a great resource as far as asking questions. They're available to you every Tuesday at noon Eastern and Thursday at 4 Eastern. You'll notice that these are in Pacific Standard Time, so not to throw you off. But then you would just register here. This is really great because it's for clients that are both our current clients that are in implementation and out of implementation. So you can hop on, ask your question, hop off, or you can hang out and listen to the other questions that other folks might have. That is all I had for you today. I'm going to hang on the line just a little bit longer and allow time for any questions that folks might have. If you don't have any questions, I really appreciate your time today and your attentiveness. Please feel free to reach out to your super users with questions. If your super users are unable to assist you, they will route your questions to Lisa, and then they will come to either myself or Lindsay McQuaid, who is the other implementation consultant on your account.
Thank you.
Thank you.